government over the past 3 years under Justin Trudeau, we've ended up seeing a complete upheaval in what people came to expect of how our immigration was supposed to work. So we are asking Albertans, since it's a change, should we be taking over the economic migrant portion of immigration away from the federal government, similar to the way Quebec did back in 1991? And should we be putting some limitations over how long you have to be in our province before you start relying on social programs? Social programs are expensive. The average person who comes to Alberta needs about $6,000 a year in healthcare, and sometimes it varies. Some people need very little. Sometimes people need hundreds of thousands of dollars. That's why we have an average, but there's always a certain portion that are going to be at either end of that. It costs $12,000 for someone to go through and get support in our childcare system. It costs $12,000 for a child to get support in our K-12 education system. The only place where we do have foreign students paying their way is in universities. And so we're just looking at having the same kind of policies that we see elsewhere. In Ontario in particular, they do not allow the families of temporary foreign workers to automatically get access to health care. The federal government just recently issued a circular saying temporary foreign workers are expected to have private insurance when they come here, and it just stands to reason. If you're going to a country temporarily, every Canadian knows you've got to get yourself covered for insurance. You don't show up on the doorstep of another country and say, hey, pay for my health care, pay for my kids' education. We just need to have the same kind of normal policies that they have in other jurisdictions.